Move on to some individual talks now, and the next talk is about our approach to patient and public involvement and engagement. And I'm really pleased to introduce Professor Monica Lakanpaul. Monica is Professor of Integrated Community Child Health at the UCL Grady Ormond Street Institute of Child Health, and she also co-leads the BRC's Patient and Public Involvement and Engagement and Participation theme. So thank you, Monica.
Thank you very much, everybody. It's a great honour to have been invited to talk to you all about patient public involvement and engagement. And firstly, thank you to Deirdre Leyden and Polly Livermore, who are working with me on this theme, and also Polly is my co-lead, just to state that at the beginning. I think it's great to have this talk now at the end of all these amazing, amazing presentations about wonderful science that you're all doing, because it grounds us in the fact of why are we actually all here? What's the purpose of what we're actually doing? And the purpose of what we're doing is really for our children and our families and their carers. So it's great to see young people here and in the room as well who really make us reflect on why do we spend all the time getting up in the morning trying to do this work and all of this money as well. So what I'm going to do is tell you a little bit about patient public involvement engagement, really to remind you, we've heard from the questions about why PAG been involved, what happens there. So this is really a reminder to everybody about why it should happen, why we should work with families, children, their carers, and how we can do this effectively. Not to give away my age, I've been doing this for quite a long time, and it's a real passion of mine. And it's amazing to think that 20 years ago or longer, patient public involvement and engagement never existed. It's really, really evolved over the years and over time, and it's been refined and refined and refined, and we're still learning how to do it well. And to me, it's a science, and I'd say it is a science in itself. How do you respect people? How do you talk to people? How do you engage them? How do you give people with lived experience a voice? And I'm sure that many of you have received an email which says, please, can you fill in the survey? And the first thing you think is, oh my God, do I really have to do another survey? And then you look at, is it 5 minutes? Is it 10 minutes? Are they telling me the truth? Or is this going to be a 20-minute survey? Well, that's often how families feel when they receive a survey that they have to fill in. And we all want those metrics filled in. We want all those variables. And they're going, there's no way I'm going to fill in that 20 pages of paper that you're sending me. So we in our ivory tower sometimes think this is the greatest science on earth. This is what we need to do. Actually, will it be feasible? Will it be acceptable? And will it be deliverable? So the point of what we're really trying to do is ensure that we actually prioritize the right questions. Again, we can have the best ideas in the world, and you go down to the families and they go, no, this isn't a priority for us. We need you to talk about something else. How do we plan what we're going to do? How do we deliver it? How do we evaluate it? And how do we share it? And how do we do this not in our silos, by ourselves with our own ideas, but actually collaboratively together with our families and the children and young people? And this is an old Lancet report, but it's actually quite critical, and it still stands really. 85% of investment in medical research has been wasted with the wrong questions being asked and a lack of impact on clinical practice. So if you track back, the reason we are all in this room is to have clinical impact, and that's why we're here. So we have to ask the right questions that mean something to the people who really we're serving. But there are barriers to patient public involvement engagement, and we sometimes worry about how to do it, and it can be nerve-wracking. You know, many people very comfortable working with their research, but actually going and engaging with people who may say what you're doing is not really quite right or what they want, can be a little bit challenging for ourselves. And there's barriers to it for ourselves and for other people, and these are just some of them. We've done quite a bit of work in this area, trying to work out how to build that relationship, how to understand how to do this better. When I say language, of course, we have a diverse community, many different languages. Just translating everything into a different language on a piece of paper, I can tell you doesn't work, and I could stand here doing another talk for a whole hour on that. But actually, there's a language from our medical language that sometimes people just don't understand. The acronyms that we use, PPIE. Trust trust is not easy. It's something you have to work at, and just going and asking people a question, extracting that information from them, doesn't mean they're going to tell you the truth. And there's a skill in how to build trust. Cultural restrictions, what I mean in that is, well, saying to somebody to come at 1 o'clock on, yesterday was our Diwali, and saying, I want you to come tomorrow and do the study on your Diwali, which is your holiday, but I expect you to come and do that for me. Well, we have to think about cultural days, holidays, times. Some people wish to be supported by other people when they're involving themselves. They don't want to come on their own. And all of these things we have to think about if we're going to be effective. It can sometimes take a lot of time out of people's lives. And again, we sometimes don't realize that tube ride to us and back can take a long time if you're changing tubes. Do we really value that as much as we should? And I say no incentive, and I mean what I mean is, of course, we now give incentives, and we always, we think about people, we try and reimburse them. But still, why should somebody do this for us? And what are we giving back? Are we sharing our findings? Do they know where our research is going? Do they actually know that this is going to make a difference to their lives and other people's lives? So what's the incentive for them to do it? Everybody needs motivation in life. So good patient-public involvement, as I say, it's not about doing things to people. It's about doing research with people. And that's what we're very proud of in our theme, is trying to support all of you into how to develop that collaboration, that partnership with the children and young people and their families and carers to improve the research that you all do and make it more impactful and valuable to them. So how can we do that? Well, actually, we need to be doing it every single stage of the research. The research that the PPIE will inform how you design your research. I know that in the morning sometimes I have to take 2 or 3 tablets, and you look at the size of them and you think, oh my God, I don't want to swallow that. How are these little children going to swallow that? Are you really thinking about how many tablets they need, or how it's being given to them, the taste of their tablets? What's the strategy you're going to use to actually give them time and space to think about what you're asking them to do? And can we actually make sure that what we do is equitable, and we're not just involving people who maybe are easier to involve in our studies, but actually a diverse community who may be otherwise people you might not have thought of including. But that means that the beauty of it is that it does improve the quality and the impact of the research. And we'll all have to not just publish papers and say how many papers that we have published, but actually what impact that research has happened. That translational pathway is going to be critical, and it is critical. And if you're going to do multiple research studies, actually developing a sustained partnership is beautiful. I had people yesterday on a study I'm working on who've been with me now for nearly 15 years on different studies, building that relationship, that knowledge base, understanding how to reach communities. And that trust was built year after year after year. And we also can have other partner organisations, such as the charities, who can help us in that relationship building. So I've mentioned improving research quality and impact. I've mentioned improving research design. But it's important that what we really hear as well is about reducing inequalities in health, but also health equity as well. And we want to make sure, as I say, there's an increasing move towards ensuring that we do reach underserved communities and underrepresented communities. And I never say hard to reach, because actually people aren't hard to reach. You just have to get out of your office and get on the tube and get to those community centres and walk around the roads and sit in a coffee shop and have a pizza with somebody, and you'll reach people quite easily. There's a knack to it, and we're using more community facilitators, community members who can really build that relationship and partnerships with different groups of people. So this is what we're trying to broker. Individuals in a lab doing amazing research, as we've heard today, to build that brokerage with the patient, public, and the children and carers, and them to really trust why you're doing this. If you think of it, we're taking people's blood, we're taking people's DNA, where it's like, why are you doing that to me? What is happening to me? It's a scary place to be if you're on the other side of this. So different ways to do this, as I've mentioned, research plans. Come to us early. If you want to ask how to do this better, if you want to get information, we're all there to give support and advice, and you can contact Dee as well, and she'd be more than helpful to direct you or help you and support you. We're also training, we're creating training tools, we're just developing a guidance framework on how to work with children and what things to think about when you're doing PPIE. Think about how you're going to manage the research, how you're going to think about the terminology, as I've mentioned, lay language. I mean, there's lots of tools now out there to help you, but literally, you know, give it to somebody and ask them, can you read that? Can you understand it? Does it mean anything to you? We want to carry out our research, and I'm not going to labour this too much. There's a bit of a continuum, and we can talk another time about this, from PPIE to co-creation. And we talk about co-developing. And that's really what you want to get to, a point where you're really in partnership, not consulting only with people, but moving to a place of actually co-developing research, interview questions, surveys with people, asking the right questions. And then communicating our research findings effectively. Yes, we all author and have papers in journals, but do we include our community members or our patients in any of those publications? We try to, and we do. We're like, here, can you read this? And actually, does this make sense, what we've said? Is this true to what we're saying? It's important to think of blogs and other ways, and videos. We use a lot of videos now rather than just translated material, lots of audio material, and important to give back to people, disseminate your findings effectively, and evaluate the impact on short-term and long-term impacts. There are lots of different ways of doing this, and we have many different techniques, from small discussion groups, just where people feel comfortable, can bounce around ideas, to larger workshops, to actually one-to-one discussions. Sometimes people don't feel safe to talk in a group, and I think we should respect that and remember that, and surveys as well. But there's also some very exciting ways of engaging people in their voices. There's theatre, there's music, there's drawings, there's so many creative ways that we're now using storytelling to enable people, not just in the dissemination, but actually in the co-creation of the studies that we're doing. Sometimes you have to go to a group of mixed individuals, sometimes to a charity, and sometimes you'll come to us, to our YPAG, who again, we support in having engagement activities with yourselves and feeding into what you're doing. And again, think right at the beginning of when you're setting up your studies, have I got a PPI advisory panel right the way through my study? Have I got a steering group or a committee group, or people who are from a COI on the application itself? You know, start thinking this from the moment you wake up with your idea. Don't leave it to the end. Here are just some examples. You've heard a lot of examples today, so I won't labour this too much, but here are some examples of what you, of some great projects that have been happening. We have been involved in the special cell therapy called the regulatory T-cell therapy work, and that's been involved in how you explain the rationale about different dosing. What does that mean to people? Making sure that parents have access to non-biased information about the treatment itself. Making sure that we make the information very clear on our consent forms. Do people actually know what they're getting involved in? Making sure we don't use jargons, abbreviations, people know what that means, and not using lots and lots of technical terms that really switch people off and they're like, I'm not really sure about this. But patient-public involvement, like I said, is fun as well. The involvement part is all that side of the research cycle, involving people in the co-creation, involving people in the actual surveys and the feedback. What are you doing? How do you do it? But actually, people are scared of the word research. You know, it is a terminology that we found actually switches people off. And at a time when we want to be doing more and more research, creating more and more evidence, we need to be actually having the public part of us, and the public as actual advocates of research, of why they need to do it. And so we have been holding rare disease days, international clinical trial days, and there's many outreach programs as well to make young people and their parents as well and their carers really understand the importance of research and build the next community. Just for a minute, I want to tell you a little bit about what else we're doing. This is a lot of the internal work that we've been doing at the BRC, but actually what's also important is that we share knowledge across the country. We should all collectively be doing patient public involvement well across the whole of the UK. And it's important that we share that learning. And we're very pleased that we were given the opportunity in this BRC to really look outwards. And we did that over the last couple of years of doing a survey with colleagues across the country. What were they lacking? What were the needs? It's a real need analysis. What did people want from a community of practice talking about the challenges around patient public involvement? And it was very clear that people felt they didn't have a tribe. If you're an oncologist, you have a tribe. If you've got somebody in respiratory, you have a tribe. If you're working in the space of PPI, where do we sit? We sit across so many places. Yet we need to be sharing our knowledge, our experiences, our barriers, our challenges. And so we engage with people who are not just clinicians, but professional staff as well, people in the research offices. And we've come together. We've held 2 conferences already. We have working groups as well. And we'll be having another conference next year supported by Oxford. And we've managed to leverage more funding from their BRC as well. So we are going to be publishing. We are going to be sharing our experiences. It's a safe space to say, not really sure about the ethics on this. I'm not really sure what I do about this. How can we do this better together? And how can we advocate for more involvement for children and young people? Please join the workshops. Please sign up to the newsletter. We need to have a bigger voice in this space and need to be supporting our families. If you want any more information, we have the website where you can find more information. We have our impact report, our highlight report. So just to end on that, we want to show you a short film because I can stand up here and speak, but actually you need to hear the voices of a young person to really understand what this means. So if you could just take a few moments to watch this next film.
Hello, my name is Remy and I receive gene therapy treatments at Great Ormond Street Hospital. It all started off in 2007 where I got admitted to Great Ormond Street Hospital where I got diagnosed with CGD. It all started off with flu, fevers. My parents got very worried, so they took me to a hospital. Every hospital in Preston where I was born had discharged me home saying that there was nothing wrong with me. But then in Liverpool, in Alder Hay Hospital, I got diagnosed with lung problems. Precisely, I had liquid in my lungs, which was approximately 2 or 3 days left of me with living. Then I got transferred to Great Ormond Street Hospital. Like I said, they diagnosed me with CGD. Everything was fine up until 2020. Up until then, I had yearly visits. 2020 was when I got diagnosed with lung fungal infection. I had the regular visits, which meant I missed out a lot for my GCSEs. Then I started antibiotics. I was very fatigued, very underweight. Then we discovered that I was going to the loo more frequently. I got diagnosed with IBD, which is inflammatory bowel disease. On top of that, I also had pneumothorax, which is a collapsed lung. So there's a little gap between your top lung and your rib cage. From my experience, it's very painful, hard to do anything. Then, because of the IBD, of course, I got started on medication, but that didn't work. So I went to be admitted on 2023 in June. To Great Ormond Street Hospital where I had TPN, which is total parental nutrition. So it's instead of eating and drinking, I had this fruit vainly. So it's instead of food, so I couldn't eat or drink for about a month. Then I started on a bland diet and slowly increasing my intake. In October 2023, I had my lung surgery for the pneumothorax, the collapsed lung. Everything went well up until January 2024, where I had osteomyelitis. So I was on regular antibiotics every day. A nurse came to my home to give me the antibiotics. In March 2024, I got started on my gene therapy where they collected my cells to be corrected. The admission was in March. It was only about 2 weeks long. Then I got discharged and waited until they got in contact with me to admit me again to hospital for chemotherapy and to have the corrected cells put in. This was in 2024 June. I was in hospital for about a month, 1 month and a half. I got discharged the 31st of July, luckily for my dad's 50th birthday, all the way until having regular visits, monthly visits, then 3 months. Luckily now I've got yearly visits. In that period of time, I managed to gain some friends, pass my driving test, which I really enjoy driving, attend a bunch of concerts, do a bit of travelling around the UK, but especially the most important for me is to finish my A-levels, which also led me to University of Winchester, which have regularly accepted my offer. Thanks to University of Winchester and the WhatsApp group, I met a lot of friends, including a girlfriend. I heard about GOSH, a young person's advisory group for research, when I attended the Great Ormond Street Hospital BRC Gene Therapy in Pediatrics 2025 event, where I just gave my opinion of my experience for the gene therapy and overall the care I received. So basically I sat on a patient panel to speak about my experience as a patient to help future researchers think about how important and how it is to have the patient view at the centre of their research development throughout. I've joined Great Ormond Street Hospital YPAG so I can continue to have my voice heard and to represent other patients too. I think it would really benefit me and other people to share my story and to see what it's like to live with a condition, and meaning that it's a condition, you don't have to enclose everything within yourself. I would want to appreciate all of the work Helen Braggins has also done from CGD Society, who I met in 2007. Of course, I wouldn't have remembered, I was only 2 years old, but my parents really like her. So do I. She helped us do everything, sorted out absolutely everything. I would also like to thank my parents and my sister who helped me go through all my admissions. They were there for me all by my side all the time, helping me make decisions not just by myself, but also taking great care of me even after admission, where I had to be isolated for quite some time. Thank you for listening to my talk.
Is it on? No, yes. Thank you so much, Monica. That was a really great talk. I attend the YPAG meetings and I've met Remy. They are such an insightful, engaged group. Really, they make such a difference to the research that we do. Yeah, it's why we're here, and it's a lot for a young person to deal with, but it's very uplifting as well. So thank you. Have we got questions? I know there are a few online. Yes, Flavia.
Thank you, and thank you very much for a very inspiring talk. I wonder if you could just give us, in very summary words, the first steps that you would advise a new researcher to get into PPIE. And I'm asking just because it's, despite all the amazing support that I got, and I consider myself very lucky that the YPAG and Deirdre are experts, and I had no idea about PPIE. I had no idea what I was doing, and they taught me how to do PPIE on top of supporting me with my work. But it's still quite overwhelming for a new researcher. So I wonder what advices you have as a first step for a BRC supported student or early career researcher. But also some of my colleagues that are attending today online, for example, aren't supported by a BRC like this one. So I wonder, are there any resources that are available to us out there?
Yeah. So a couple of things that might be helpful to your colleagues. I think, in our BRC, as you say, we're very lucky. We have D there, we have training material, we have online material. The thing that I think that works very well is finding somebody who's done it before and finding a mentor. So there'll be many people in this room who have been involved in PPIE before. And honestly, I think that to me has always worked the best when young people have come to me and said, I'm a career researcher and a bit worried about this, what can I do? And having that support, either peer-to-peer support or somebody senior who's done it before can really help through the real life, the lived experience of doing, which is different than reading. For colleagues online who are maybe not supported in that way, that's exactly why we've built this collaborative. So the National Collaborative recognised that there were people all over the country at very different levels who were not feeling supported or didn't really know how to do it, not the, the touching and the feeling of it. And that's what we've been doing in these 2 conferences and many more to come, we hope, where people can honestly have a safe space. It's not a formal conference. It's a very much like, I don't know how to do this. Can we talk about it? Hearing from young people who've been involved, hearing from us who've done it before. There's online training material, lots of that from NIHR and ourselves now, but people can go to. So 3 steps: read the online material, go to the websites, there's lots of videos, find a mentor that you can go to, join the National Collaborative, and also the NIHR, the Research Support Services, also do in every region have a support service to help everybody if they want to access it.
Thank you.
Thank you. Dee.
Yeah, I was just going to say that if anybody wants to come along to a YPAG meeting, you're very, very welcome, as you can come as observers. So the YPAG don't mind. We've got a young facilitator here today. I don't think she'd mind you coming along. It's a really good way to see how researchers approach speaking to children and young people. So they run all day, 6 times a year. Just get in touch with myself, and you can pop in for online for part of the day or all of the day, and just see how different people approach delivering their PPIE, and you can learn through actually attending. So yeah, you're very welcome to come along.
Thank you. They're a lot of fun, so come. Other questions? I know
Thank you, Monica, for the interesting presentation. I had a question about you said the PPI is new and it's recently we've been
Sorry,
learning.
I
PPI is new and we're recently learning. Recently it's been started. For the low middle income countries, it is relatively even very new. So how would you have any suggestions, couple of tips on how do we, what lessons or how can we apply these learnings to the low middle income countries? How do we advocate PPI over there? Any suggestions on that?
So, good question, because I came back from on a recent trip exactly about that, and we're doing 2 things there. One is I sit on the DBT welcome panel and getting that actually into the documents that says, what is your PPI? And that's the way of doing it. When you make it mandatory on that funding submission, people start thinking, how on earth do I do this? One is we do have visiting professorships at UCL who do go overseas. And again, they're able to advocate for it. So that's what I was doing recently, is actually working with people in engineering and design engineering and technology and going, okay, what is your PPI structure? Can we co-create that together? So I think we can be advocates for it as well. And in every country, there is a funding structure, such as in India, there's the ICMR, and in other countries, there's other funding structures. So having that dialogue with the funding panels in the other countries, that can be supported through UCL, whoever's part of UCL, because we have international partnerships. And that's what we're trying to do, is see how we can slowly infiltrate this. But again, workshops, international workshops, if we are trying to do more international workshops to support other countries to enable them to bring this in more effectively.
Thank you. David, I know there are some questions online.
Yeah, well, one of them asks, were the YPAG involved in the decision-making of who's funded through the BRC? And I think you touched on it on one of your slides, so perhaps you could tell us a bit about how exactly they are involved in the decision-making.
How are they involved in the decision-making? So we and Dee's probably the better person to say this, but we hold our YPAGs, so we have... we welcome everybody who wants to actually apply to actually present their research to the YPAG. People can bring their ideas, they can bring their questions, of course, go to Dee first so she can identify when would be appropriate and in which stage of the research cycle, and then bring the questions to the YPAG, and then they can actually work with you, help you, and you can bounce your ideas off them. But Dee holds knows when all of those sessions happen, and she's really the first port of call to really email her, let her know this is what you want and what support you want from the YPAGs.
Maybe one more final question.
Yeah, I think this is quite timely, actually. How do you ensure that the involvement of young people really does help shape the direction of research? How do you evaluate its impact?
So what's now happening in most of our research is that we do have to explain what has changed. And I think that's why I'm saying do it early, because if you go right at the beginning of your research, you'll see what your idea already is. And then you'll be able to actually say, okay, these are the questions I had in my head. I've taken it to a YPAG, and actually this has now changed. And recording that is so, so important, that cycle of what has actually changed. There will become an increasing need to be able to show what has changed in your research proposals, because my other hat on is the NIHR Children's Research Lead. So I know what's coming down the pipeline is that we are moving more and more to have you involved children, young people and their families. What impact has that actually made? How has it changed what you're going to do? And will that impact on the delivery? Because we're going to be really hot on delivery of research. So how has that impact? And we will expect people to be able to record and reflect and enable them to share with us how that has happened. There are lots of tools out there now on how you can assess impact of PPIE. And of course, case studies and examples. So we do our impact report. So there are formal ways we can do it. But actually for the individual, there is an increasing need to reflect on that. And we just recently had an NIHR proposal where exactly that we had to say what changed and why did it change as part of our funding that we were going to receive.
Thank you. I think we need to move on. It's such an important topic. Please thank Monica. Thank you.